1. 2204 Fluid and Electrolyte NCLEX Practice. Questions with complete solutions. The nurse is caring for a patient with hypercalcemia. What clinical manifestations would the nurse most likely observe in this patient? A. Hyperactive reflexes. B. Muscle cramps. C. Nausea and vomiting. D. Positive Trousseau sign. Heavy checkmark C. Nausea and vomiting. A patient with respiratory acidosis has a pH of 7.28 and a PaCO2 of 56 millimeters of mercury. Which of the following is the most appropriate nursing action? A. Encourage deep breathing to increase oxygenation. B. Administer bicarbonate to correct the pH. C. Monitor for signs of hyperventilation. D. Assess for underlying respiratory conditions. Heavy checkmark D. Assess for underlying respiratory conditions. 1/3. 2. In a patient with hypomagnesemia, the nurse observes tremors and increased reflexes. What is the most appropriate nursing intervention? A. Increase magnesium intake through oral supplements. B. Administer magnesium sulfate intravenously. C. Provide fluids to dilute the magnesium. D. Monitor for hyperkalemia. Heavy checkmark B. Administer magnesium sulfate intravenously. A patient who is experiencing fluid volume excess is being treated with diuretics. Which of the following signs would indicate a potential complication? A. Weight loss. B. Tachycardia. C. Increased blood pressure. D. Decreased urinary output. Heavy checkmark D. Decreased urinary output. A nurse is caring for a patient with hyponatremia. What is the most important priority for the nurse? 2/3. 3. A. Administer sodium-rich foods. B. Encourage increased water intake. C. Restrict potassium intake. D. Administer an isotonic solution. Heavy checkmark B. Encourage increased water intake. A patient is receiving 4 fluids for fluid resuscitation. The nurse notices edema in the patient Euro's legs. What is the nurse Euro's priority action? A. Administer a diuretic. B. Elevate the patient's legs. C. Reduce fluid intake. D. Continue with the current infusion rate. Heavy checkmark B. Elevate the patient's legs. A nurse is caring for a patient who has been diagnosed with hyponatremia. Which of the following symptoms should the nurse expect to find? A. Increased thirst. B. Seizures. C. Hypertension powered by TCPDF. www.tcpdf.org. 3/3.